Hello, my name is Dr. Rodwin, and we're going to look at the shoulder and how to use the Acuballs on it to be able to help yourself. Now, I will demonstrate later how to make use of either the small one or the big one, but I do want to explain it with the skeleton right now so you can actually visualize it. And what happens with the shoulder when it gets really tight, we have different muscle groups. Some of them are known as the rotator cuff muscles, and there are actually 4 different muscles. One of them runs through here. The other one comes through here. The other one's on the bottom part of your shoulder blade, and the other one is actually, believe it or not, in your armpit. And all 4 of those actually are called the rotator cuff muscles. So they're actually known as the supraspinatus, the infraspinatus, the teres, and the serratus. So when you add them all together, they cuff your shoulder. Now, in order to work the shoulder, you should be working the shoulder area with the Acuballs, but as well the upper back and the neck, because it all interrelates together. Because when the shoulder gets tight, there's some muscle groups up through the neck that go like this that get tight as well. And a good thing to do would be to take the Acuball and go along the edge of your shoulder blade to work some of the back muscles that are down through here. You'd also work through in between your shoulder blades. The top part of your shoulder blade, there's some really tight muscles up through here. One of them is known as the trapezius, and the other one is actually the levator scapulae. It inserts into here, that muscle group, and comes off of 3 vertebrae in your neck. So it's actually good to take the Acuball, and usually the big one, and just dig in there with it and work your way up into it, into your neck as well. Now, to work around in the shoulder, you can either try the big one and work into different areas, or use the small one to get into these small little rotator cuff muscles below the shoulder blade, above, and into the back of your shoulder and arm. Because you can actually work down into your arm as well through the tricep and through the front, the bicep, and the chest area. So let me demonstrate that to you. I'm now going to demonstrate how to use the big Acuball on the side of your shoulder blade. There are some big back muscles that attach right in here that you want to get into. So if you actually lie on it like this and move it along the side of the shoulder blade that I showed you earlier on. So you can actually either rest it there when you find the spot, or you can roll it through there, which feels so good when you find those tight spots. And then what you can do is move it up into here and move it down your arm and roll into there with it as well. And you can either roll it or rest it. The patients often ask me, how long should I leave it there? Well, you could leave it, if you find a nice spot, you could leave it for a couple minutes and just lie on it and read if you want. Or you can roll around on it. So that would be the areas in through the arm and the shoulder blade. Now, if you want to take the Acuball and use it in between in your middle back too, because when you have shoulder problems, you want to get it into here as well and use it on your middle back. And you can either rest on it and keep moving it down through the spine area, or you can actually just rest it there and then roll it later. Now always make sure, you see that I have pillows, so make sure you have your head propped up to rest it properly. And then take this Acuball, and we talked about the levator scapulae earlier on. It inserts into the top part of your shoulder blade right here. You want to take this Acuball and rest it there too. And if you move your arm back like this and up, you can actually get a better sensation of having it working the muscle really well. You can move it up through into the neck area to work where it starts out of your neck as well. And then back into here to get your trapezius. That would be the big Acuball on the back area to get the different regions. So now I'm going to show you how to use this small Acuball on the small little rotator cuff muscles, especially the supraspinatus and the infraspinatus. Now, why they call them the supra and the infraspinatus, there's a little piece right here on your shoulder blade, and it's called the spine of the scapula. And underneath, infra means below, so the infra runs through here, and the supra runs above. And what you would do with the small Acuball is you'd go below that spine, bony piece, and place it there, and you could rest it or roll it through that muscle group because it runs all the way down into here. And then you could just rest on it. And then for the supra, which is the one above, you could just dig it in like that. And it's harder to roll on this one, but you can roll and then get right down to where the tendon is at the end piece here. And you can just rest it like that. So now we're going to use the big Acuball on the front part of the shoulder and chest region. So when your shoulder is tight, it does build up tension on the front, especially if you've been at a desk and you round forward. You've shortened all these muscle groups, your pectoral muscles and your bicep. So to take the Acuball and work through your bicep, one of the bicep muscles comes up into here in a tendon, and that one's called the long head of the bicep. And what you'd want to do is find that little groove, and you could dig that Acuball in there. Ow, and when you find it, it's sore. And you can actually just rest on it like this, or you could roll it. So you could move down into your arm and roll it through your bicep, or just rest and think, oh, that feels so good. I'm going to work this out and feel so much better. And then after you're done with your bicep, depending on how far you want to go down, because you could go all the way down your arm rolling it, you could move into your chest, and that would be your pectoral muscles. And they go underneath your collarbone and run all through your chest. So you could actually start on this piece of your pec muscle and then keep moving it in. And sometimes it's nice to actually take it and just rest it right near where the pectoral muscles attach into your breastbone, your sternum, and just rest it there like this. And it feels good if you actually move it along there. And you can open yourself up if you do have the tendency to round forward over time by doing this, because it releases all of these muscle groups. And that would be the front part. Enjoy your Acuball session with your shoulder.